I'm very, very excited to again be able to introduce Mr. Tim Perry, who's going to be doing Down on the Farm Part 2. Tim began his career in Tennessee EMS in 1982. His works included ground, air, and fire rescue in Lawrence County, Maury County, Sumner County, and Putnam County. Mr. Perry spent 5 years in emergency medicine at the emergency department staff and charge nurse at Vanderbilt University Medical Center and Southern Hills Medical Center in Nashville. Tim was a flight nurse at Tennessee Air National Guard with the 118th Aeromedical Evacuation Squadron in Nashville, Tennessee from 1991 to 1995. He has worked in C-130, C-141, C-9, and the C-5A Galaxy. He's also a graduate of the United States Air Force School of Aeronautical Medicine at Brooks Air Force Base in Texas. And Mr. Perry has worked as regional operation manager for Erlanger Life Force in Chattanooga, Tennessee for 29 years, as a regional operation manager for Tennessee Life Force 1, Life Force 2, and Life Force 5 as a flight nurse. Tim's certification and licensures, he has quite a few. They include licensure in Tennessee and Georgia as a nurse and paramedic license, National Registry. He's a certified flight nurse. He's a certified medical transport executive. On top of that, Tim's just a real good guy. I think you're going to enjoy tonight's presentation. Again, anytime if you have any questions or comments in there, stick them in the chat section and we'll get them taken care of. And I think without any further interruption, I'm going to turn this over to Mr. Perry. Tim, you can share now.
Steve, thank you. That's going to be pretty. That introduction is going to be pretty hard to live up to. I greatly appreciate it, guys. Very flattered, very humbled to be asked to come back with you guys. Thank you for having me back. I hope a lot of you guys were able to see Down on the Farm Part 1 a little bit back. During that talk, we did a lot of talk about tractor accidents, tractor rollovers, implements involving tractors. Whole lot of information in that. We ran out of time on that one. A little bit about my background. I grew up on farms. I still live on a farm. I'm not a professional farmer. I just play one. But the EMS part of it, we see a whole lot because in Southeast Tennessee, Middle Tennessee, we're very rural. We have a lot of accidents, not like you guys out in the Midwest. You guys far trump us on that. That being said, the farm accidents that we have here, I was talking with Mary and Steve earlier, farm accidents we have here, it's a very low volume occurrence that we have, but the acuity is very high and the amount of training is very low on these. And that's really the reason that several years ago that I wrote this lecture was just very little training out there on the farm agricultural side. So tonight we're going to start with talking about grain bins and manure pits. Some of you guys in the Midwest may know what these are, especially the manure pits. But yeah, we're going to go into the discussion what these things are, why they're dangerous, some things for you to consider, things to think about. So we're going to start off with grain bins. Pretty much everywhere in the United States, anywhere in the world, you're going to have these grain bins. So when you get into grain bins, the number one cause of death is suffocation involved in these accidents. Once these people are pinned in these things, always assume that they're alive if they're completely submerged until you know. So how do grain bin accidents happen? Well, there's several ways that grain bin accidents happen. The big one has probably just been submerged in the grain. Basically, people get out on the grain with the augers running, and it pulls the victims down into the grain. The other is what's called a crush bridge. And just where there's old grain in the grain bin and the auger has pulled the grain out from under it, but the top of the grain has hardened because of the humidity. They put fresh grain on top of it and people walk out on it doing maintenance or whatever they're doing, working on these grain bins, and the crush bridge collapses and pulls them in. I know that sounds pretty crazy, but guys, that's actually very common. Actually, one of the first working in the fire department on a rescue truck, one of the first accidents I worked involving grain bins was a gentleman at one of the local farmers co-op, and he had walked out on the grain and it had collapsed and it had pulled him in. We got this call and none of us had any training. So, going out, we were fairly nervous. We really didn't know what we were getting into. So we were actually fairly scared till we got out there. We got up in top of the grain bin. The guy, he is trapped, submerged down. And it was funny because it was only down to about his knees. And at that point, it was humorous. We thought, hey, this is no big deal. But we were pretty smart. We threw some spine boards out over the grain, walked out to the patient, got to him. We were going to take a shovel and just dig him out. We really didn't think it was a big deal. But it didn't take very long until we realized for every one scoop of grain that we pulled off of this gentleman, several more caved in on him. And it wasn't any time we had this gentleman, he was trapped to about his waist. It was very scary at that point. We thought there was a point that we may kill this guy. So we really didn't know how we were going to get him out because we didn't have any training. But luckily, we had a 55-gallon metal barrel at the fire hall that had came with soap in it that we used to wash the engines. And when we ran out of soap, we thought, well, hey, you're pretty cool. We got this 55-gallon barrel. We'll just keep it around and we'll get to use this thing maybe someday for something. We'll find something to use it for. So at that point, we remember we had that barrel. So we called the fire chief and said, hey, chief, can you throw it in the back of your truck and bring it out? Well, when he did, we cut the top and the bottom off of this 55-gallon drum, worked it down around this gentleman, and we were actually able to dig him out. It took a little while, but we were finally able to dig him out because as we put that down around him, it kept the grain from caving in on him as we dug him out. Believe it or not, 2 months later, we worked the exact same kind of accident, the exact same grain bin, and we still had our barrel and we were able to get him out pretty quick. So you guys out in the Midwest know that all the rescue trucks out there, they're required. There's a commercial device now that those guys have of getting these patients out of these grain bins. So just be careful entering these grain bins because there's a lot of carbon dioxide because of the grain fermentation, things like that. Dust explosions are a very high risk around these grain bins. Be very careful about sparking that off and setting off one of these. I don't know if you've ever seen one of these things. I've never seen one explode, but I've seen the aftermath of one that exploded. It's pretty impressive. So the dust explosions are pretty high risk. So just be careful with any kind of flames or anything around the grain bins. So just if somebody is completely submerged in one of these grain bins, guys, really there's not much of a way to get them out other than if it's a metal grain bin. The key is to cut 3 upside down triangles at 120 degrees from each other. And what that does is it allows the grain to evacuate the silo evenly. Just be very careful not to cut the triangles too big because if you do, you lose the structural stability of the grain bin and it can collapse. These metal grain bins, you have to be really careful because you can't really just grab a K12 and start cutting because if you do, that throws a lot of sparks and that runs a risk of explosion. So they kind of recommend using maybe air chisels if you have those. But now, kind of the way they're suggesting now, because it's a lot faster than trying to use the air chisels, is actually using the K12 and use a charged fire hose and spray water on the blade as it's cutting, just to prevent any sparks or causing any explosions or any risks like that, so it can drain the grain evenly and hopefully you can rescue your patient. Just remember, when you make these cuts, they have to be considerably high up on the silo because down below 5 to 6 feet is just machinery, the auger. So just be very, very cognitive of that. You have to start cutting into one of these things. Again, air chisels is the way to go. Abrasive saws, if you can put water on it to keep these things from exploding. If these patients are partially submerged, kind of like the patient that we had, we actually joked about this on the guy that we had that was pinned from his knees down. We had actually joked about tying a rope up under his arms, tying it to the engine and backing up and pulling him out. Actually, if they're up to their knees, you'll actually pull them in half trying to pull them out. There's that much pressure on their lower extremities. So you can't really do that. Just again, if you have to enter one of these things until you know the air is clear, make sure you wear air packs because the carbon dioxide, things like that, the air may not be very clear. I did this lecture for a professional rescue department, Chattanooga Fire, and these guys were the confined space rescue guys, and they were talking all of the issues with that way over my head. But Just be very careful until you know the air is clear to wear air packs and protect yourself. Yeah, and also use spine boards, OSB board, things like that. If you have to walk out across the top of the grain to keep yourself from getting sucked in. Guys, remember the augers on these things that are pulling this grain. Make sure that thing is turned off because if that thing is running, that thing can move about 3,000 cubic feet of grain an hour, which is pretty fast. If you think about a large human, that's about 8 cubic feet. So it wouldn't take any time for it to pull somebody on top of the grain into the grain bin if that auger is running. And speaking of the auger, that's another lately that in Tennessee, in our area, that's a couple of things that we've run across lately. Is we had a 4-year-old and his brother were playing in the grain bin, and the grain was low, and the one brother accidentally turned the auger on, and when he did, it pulled the 4-year-old into the auger. It was a very horrific trauma for the crews to work. So keep that in mind as well. That's something that you can run across. And I know this sounds like you probably don't really think you'll see a lot of these things, but if you're in the Midwest, I think you guys probably see this way more than we do around in the Tennessee area. So let's talk about manure pits. So manure pits is something most people have never heard of. So if you get into farming, the most expensive cost you have in farming is fertilizer. So these farmers and these small farms, what they do, and even in the big farms in the Midwest do this, is they will take a bulldozer or the front end loader on the tractor and dig a hole. And throughout the year, they'll take their front end loader, bulldozer, whatever, and they'll continue to scrape the top of the ground and push all of the manure down into this hole, into this pit. And the thing about that is, as it ferments, it actually makes a really good fertilizer, and it's a cheap fertilizer. So they pump this back out of these pits. And they spread them on their fields and things like that. So it's a poor man's fertilizer, and it works really good. Again, you get out into the Midwest, these professional large farms out there, they're actually Olympic-sized concrete swimming pools. It's that big of a deal because of the cost that they do this. These things can be very dangerous because throughout the year, it rains, things like that fills with water on top of the manure, and it actually becomes a quicksand. If anybody gets, around these manure pits and gets into these, we actually had a 10-year-old girl fatality a couple of years ago here in our area where her and her friend were playing and it slid off into one of these and actually had a fatality. I keep up with this quite often, and, it's amazing, especially again, with the Midwest, because it's a really hard farming area. That's where a lot of the professional farmers are at, the big farms. And it's amazing how many you can read accidents like this once a week on these manure pits. So a couple of the risks of these manure pits is as they ferment, they put off a couple of gases. Number one is hydrogen sulfide. Hydrogen sulfide is very dangerous. For you chemistry majors out there, if you know what happens when you add hydrogen sulfide to the water in the lungs, what that becomes, it becomes sulfuric acid. So it becomes very nasty on the lungs if somebody's out around these. Also methane. So there's a risk of explosion around these things or fires around these things because of the methane. So I get most of the information that I do for these lectures, these farm accident lectures, I get from the University of Wisconsin. They've got a graduate doctoral program out there on agriculture, and they do a lot of safety studies. And with that, I read a study a while back, and it was telling a story that there was on a Monday morning, there was a gentleman that became overcome by the toxic gases around one of these manure pits. Later in the morning, his son came by and saw his dad down around the manure pit. Of course, what does he do? He runs down to help dad. And of course, when he does that, now you've got victim number 2. So later on in the morning, the farmer's brother comes by, sees his brother and his nephew laying down by the manure pit, runs down to render aid, becomes victim number 3. So around noon, they haven't showed up for lunch. Mama goes looking for them. So Mama finds all 3 of them down around the manure pit. So what does Mama do? Well, Mama called 911. So yeah, Mama was smart. She knew something was wrong. She called 911. This takes a very, very tragic turn, guys. And, you know, this is why it's so important for you guys, all of us in EMS, air medical, fire, rescue, all the things that we do, that we get all the training we can, because we're only as good as the training that we have. Unfortunately, this was on a Monday morning. Sunday night, the local volunteer fire department had a meeting, and they voted two 19-year-old best friends into their fire department. So that night they were voted in, they gave them pagers, gave them turnout gear. Damas Omish are now firefighters. The very first two on the scene, once this page went out, the very first two on the scene was these two best friends, and they became victims number 4 and victims number 5 around this manure pit, because they had absolutely no training. So that's why it's so important, guys. Is you're only as good as you training. You react as like you're training. So just remember, these things are dangerous. So I was doing this lecture a couple of years ago for one of the local EMS services down in the Appalachian Mountains. And one of the paramedics, after I told that story, raised his hand and he said, I was the first paramedic on the scene. So it is a small world that he was the first paramedic in Wisconsin to show up at this manure pit accident. So just be careful, again, if you're going to use any kind of fans around these things, to use the ones that are spark attenuated to keep from causing explosions. So guys, that's pretty much it on manure pits and grain bins, things like that. So if there's any questions, you're welcome to add those in later. We can discuss those, and we will move on to some other miscellaneous stuff that happens on the farms that people don't think about. And again, knowing this, having the tractor accident part of this part of this lecture, it's always good to have, some kind of an idea, a thought, a plan when responding to these accidents, and kind of having an idea instead of just running in on these things blindly. And guys, one of the things that I always stress in this lecture is never, and these things are pretty horrific, so never approach these things with tunnel vision. Always have the overall view, look the scene over very well. Because guys, on the farm, there's a lot of things out there that can bite you that you would never think about if you're not familiar with farms. I mean, and we've all, if you've been in EMS any time at all, especially in a rural community, you've worked accidents involving large livestock, bulls and horses, things like that. Pretty common in Tennessee to have horse accidents. We'll have 3 or 4 accidents a year with fatalities involving bulls, especially around the livestock barns, things like that. These farmers and stuff getting caught in these chutes. And actually, with these farmers working on these farm stuff, we actually flew a few years ago a gentleman that was on his 4-wheeler checking his cows, and was a Black Angus bull ran over him on the 4-wheeler and broke him up pretty bad. So if you guys don't know what this is 2,600 pounds of bad attitude. This is a Charolais bull. This is about 2,600 pounds. There's 13 of these things on one of our farms down in Wayne County. This thing is a beast. I affectionately call this one Psycho, because he tolerates me. I can walk up to him. He just gets up and walks away. But I can promise you that Phil would not make a good LZ for a helicopter, because he would fold it up like it was tinfoil. I actually saw him do this to a solid steel gate one time, because the cows were in heat. They were on the other side of the fence, and that was the side he wanted on. And he folded that gate up like it was tinfoil. So just be careful that these bulls are out there, these cows are out there, and you guys will work accidents involving these things. There's none of us been in EMS that had never had had one of these bad boys chase us back across throughout the house or across the yard. And every farmer has one. Usually they're Australian shepherds, and they love to run around behind you and bite you in the back of the leg. So just remember, there's dogs out there. Every farmer has them. So what kind of injuries can you have with cattle accidents? Well, guys, pretty much all of them. I mean, head, chest, abdominal, even death. Horse, the same deal. Spinal cord injuries. I mean, a horse actually killed Superman. So paralyzed Superman. So there's high risk of spinal injuries involving horses. So we get those accidents, just remember they're going to probably need really good spinal immobilization. I had a good friend of mine, his 12-year-old son was killed on a horse that just bent forward and threw him forward and broke his neck and killed him. Chemicals. Guys, every farmer on the planet is loaded down with chemicals. These things are everywhere on all the farms. Anhydrous ammonia, guys, if you don't know what that is liquid fertilizer. And it's fairly safe as long as it's contained. One thing about anhydrous ammonia, once it leaves the pressure vehicle of a tank, it gets into air, it can become a gas, and everything downwind is very toxic. This is very dangerous, anhydrous ammonia. Of course, there's gas, diesel, hydraulic fluids, weed killer. We're going to talk about insecticides, the organophosphates. They're pretty dangerous. We've also, all these farms have anhydrous ammonia. Ammonium nitrate. If you're familiar with what ammonium nitrate is, it is a solid fertilizer that Timothy McVeigh bought down the Merle Federal Building in Oklahoma City with about 5,000 pounds of that and a couple of gallons of diesel. So it's very explosive. So if you ever around a fire or, on the farm that there's ammonium nitrate, be careful around it. It's very explosive. Actually working on a rescue truck one day, we pulled up on the highway to a tractor trailer that was on fire. The brakes had overheated and the back of the trailer was burning. We asked him what he was hauling and he told us ammonium nitrate. We just got in the engines in the rescue trucks and we backed off and let it burn because of just the risk of the explosion. So that stuff is very dangerous. So let's talk about organophosphates, guys. Those are your pesticides, and that's probably more common than people realize because it goes very unnoted, undetected, undiagnosed of what it is. It's very dangerous. It is a acetylcholinesterase inhibitor. And what that means, guys, if you're a paramedic, nurse, doctor, whatever, you guys know the drug anectine, acetylcholine, that is the exact way that drug works. So organophosphates absorbed through the skin can work just like anectine. It's very dangerous. The military uses it to make its nerve agents. So that's how dangerous it is. I mean, even the level of organophosphate pesticides that the farmers are spraying on their crops, the home guys that are spraying it out around your house and things like that. I actually had a friend that I graduated high school with. His dad owned a pesticide company, and he had been spraying outside all day on a windy day, and it absorbed through his skin. And he actually had seizures, went into flash pulmonary edema, went into respiratory failure, and passed away. So organophosphates are very dangerous. Again, it goes way underdiagnosed, but they're out there. There's over 1,700 hospitalizations annually for organophosphate exposure. And guys, I would be willing to bet you that 1,700 is a very, very low number. I know it sounds high, but guys, there's a lot of the stuff that never goes diagnosed of what this is, and unless you know what these patients were doing when they become ill, it would be hard to really figure out. So history is really your best way of figuring out what's going on with these people. Yeah, it's farmer, or he's working for a pesticide company. He's been spraying pesticides all day, and he got really sick, had seizures, short of breath, went into respiratory failure, was incontinent, things like that. Those are things like that should key you in of kind of what's going on. Again, it's well underdiagnosed because nobody really knows what it is and figures out what it is. Like I said, again, it's a acetylcholinesterase inhibitor, so it's very dangerous. So treatment, immediate airway control and ventilation. These are the guys that once you get them intubated, you probably need to put them on a lot of PEEP because they're going to be in flash pulmonary edema. You want to try to push the fluid back out of the lungs. You want to do that. They're going to require Lasix to try to pull the fluid off because they're going to be in pulmonary edema. The big drugs that they use in these, if you've ever been in the military, you've gone through ground crew or air crew chemical, you know what the fix for that is. It's atropine, and that's to just, prevents the bradycardia, things like that. And the 2-PAM chloride, we carry that on the aircraft. And the thing about that is we don't care it for the patients. We care it for us if we're exposed. So that's really the way most of the EMS services or air medical programs that carry 2-PAM, it's not for the patients. It's for our exposure. So before you put these guys in your trucks, before you take them to the ER, before you put them in aircraft, things like that, guys, make sure they're well decontaminated with soap and water. If you have to RSI them, take them down to intubate them, just remember anectine, acetylcholine is contraindicated because they're already loaded up with a acetylcholinesterase inhibitor, so don't give them that drug. Protect yourself, guys. I know when you're decontaminating these patients, the little gloves that we carry on the aircraft, on the ambulance, the little patient care gloves, those are not sufficient. Those will not work. Organophosphates will leak through those gloves. You need the big level C PPE gloves. Those are the great big yellow dishwashing gloves to decontaminate these folks. Just be careful not to contaminate yourself. One thing about organophosphates, if they've been exposed over 24 hours to the organophosphates, they're probably not going to be able to reverse it. So just be careful not to contaminate your ambulance or not to contaminate your aircraft, because you do, those vehicles are going to be down for some period of time being decontaminated. So take care of yourself on those. Dioxin, herbicides. Dioxin, I don't know if any of you guys on here are back from the Vietnam age, if you know what dioxin is. If you remember a term from Vietnam, Agent Orange. It's a foliate that kills brush and things like that really fast. And during Vietnam, they used this stuff to spray the jungle in Vietnam because it worked so fast. They were able to kill the jungle. They were able to find the North Vietnamese soldiers. So it was very widely used. Unfortunately, they really didn't know what the side effects of it was. So after long-term exposure for these soldiers of dioxin, they came back. They were developing lots of cancers and increased risk of cancer, things like that. So after the Vietnam War, and they figured this out because of the Agent Orange effects, they banned it. So it's illegal. You could probably still find some of these farmers that probably still have some of this, but it's illegal. So what they did to get rid of it, in typical government fashion, they took bids from different agencies to get rid of it. Well, the guy that won it owned a company in Missouri, and what he did was he sprayed the dirt, dusty roads to keep the dust down. And so with oil and things like that. So what he did was he mixed the dioxin into these chemicals and sprayed the entire county. So to this day, the entire county in Missouri is still uninhabitable because of this dioxin. I was doing this lecture in Springfield, Missouri, and when I started telling it, everybody was laughing before I even got to it because they knew where I was going with it. Because, in Missouri, they all knew this county, the city that was condemned because of all this dioxin. Very dangerous, a lot of very dangerous chemicals on there. This is an eye, and if you're wondering what caused this was a splash of anhydrous ammonia in an eye. That's how dangerous that stuff is. It's just a splash. I mean, you would have to decontaminate that with water, but this eye is probably done. So lots of freak accidents on the farm, guys, that you never think about happening, like this one, until you get there. So this gentleman here had been working on his tractor all morning and had his tractor running and decided to check his hydraulic hoses for high pressure leaks, and he found one. It was just a pinhole, but under high pressure, hot hydraulic fluid, he lost his arm above his elbow. We actually flew a gentleman very similar to this about a couple of years ago that this actually happened to. So just remember, anything like we talked earlier about the tractor rollovers, things like that, the hydraulic fluid, it's very hot. It's under a lot of pressure. So just be very careful with that, being around that stuff. So just remove the patient from these environments, and it can decontaminate them when they got chemicals on them. You guys know how to do that, unless it's a reactive chemical to water. And so guys, farmers, man, they have medical issues just like everybody else. They have heart attacks, strokes. And so why are farmers so at high risk of having heart attacks and strokes? Well, one, if they've ever went to the doctor, they've never been compliant. They've never taken their meds. The diet they're supposed to be on, they've never done. And guys, what does Mama cook with? Lard, right? So a lot of risk of heart attacks and strokes. You see a lot of that. These older guys, they're out there 75 years old. They still think they're 40. They get overcome by the heat exhaustion. Guys that are diabetics, they have anaphylactic reactions, COPD, just like everybody else. Lots of burns on the farm. I have lots of burns, both chemical and thermal burns. You guys know to remove the patient from that environment, remove the clothing, stop the burning process, airway and fluid support, dry dressings. Because once they're burnt, they don't have any protection from the cold. They get cold very fast. Just remember, if it's chemicals, you still have to decontaminate them, get the chemicals off of them if it's burn them, or it's just going to continue to burn. The thermal burns with the water, stop the burning process, and then get those patients back dry. Farms are at high risk for fires. This is at my house. This is just this. If you had this hay right here, if you stack hay that's green, it causes a chemical issue that causes spontaneous combustion. I've literally seen stacking green square bale hays on top of each other. Literally seen it start smoking. I've never seen it catch on fire, but you're at the fire department. You work several fires every year to where these barns burn down, or these farmers stack the hay. But the big thing with the hay guys is they're stacking hay in the loft in these barns. They're stacking it on trailers. People falling off of these and falls becoming a big issue. One of the reasons I wrote this lecture several years ago was we worked a lady that had fallen off of a hay wagon. She was 10 bales high when she fell off, and they pulled the wagon over her, broke both of her femurs, folded both of her legs 180 degrees. This lady was 94 years old. She was 10 bales high on top of this hay, stacking it. Her 92-year-old sister was throwing her the hay, and her 84-year-old brother was driving the tractor. So, yeah, when I grow up, I want to be just like them. But so falls are a big risk. Electrocution, guys. Electrocution is a big risk. I put electrocution in there, especially around these dairy farms, because the electric cable stuff getting pretty bad shape. Also, several years ago, working in a ground truck in Tennessee in the fall. In the fall, we have the dew and stuff on the cold mornings. We had a 9-year-old girl. She went home with her best friend on Friday night to spend the night on the farm. The girls woke up the next morning. They were playing out in the backyard. Well, Dad had a black Angus that was absolutely crazy, and he had ran a hotline around part of the pasture to keep this bull away from the cows. And the regular generator was not producing enough current to keep him on the right side of the fence. So he hot wired it into a 110 light socket and put a copper penny behind the fuse. So this was a 110 line now. And the little girl walked up to the line and grabbed the fence. And of course, she did it with open palms, and she was stuck to the fence. And we defibrillated her many times, but she still passed away. We were never able to get her out of VFib. Lightning strikes they're pretty high risk around farms, because these farmers work out around this environment pretty heavy. If you're in Tennessee, if you're wondering where we rank in the United States for lightning strike fatalities, we are number 8 in the United States for lightning fatalities. You get down around Mississippi, Louisiana, Alabama, Florida. Those are the top 4 in the United States. Michigan's up there pretty high because of the Great Lakes. Again, we've already talked about falls, a lot of falls on the farm. Electric fencing, again, we talked about the little girl where Dad had ran the line into a 110 light socket. Really not a big deal. If you've ever been hit by one of these things, yeah, it hurts. It's not a constant current. It pulsates. If you ever get hit by one of these things, pretty uncomfortable. Makes your eyes kind of go black, makes all your muscles cramp up, pretty uncomfortable. Not a big deal for a young, healthy person. You think of an older gentleman with heart issues that gets into one of these things, could possibly be bad. My neighbor recently said, "Hey, dude, I got a friend's electrician. He can make you one of these things. It's about 10 times stronger." I'm like, "Why would I want one? I'm the only one that ever gets in it." So these things can be dangerous. It's getting that time of year in Tennessee, southeastern United States, other parts of the United States. Deer season is opening up. And the reason to bring that up, guys, a lot of deer hunting, things like that on the farm. You have these hunters. We'll probably fly 4 to 6 patients a year falling out of deer stands. And guys, just think, this happens out in the woods. You can't get your rescue trucks up there. You can't get your ambulances up there. So have plans to get these patients out of the woods, whether it's a side-by-side, just however, Stokes basket with a bunch of people, however you plan on getting them out. Guys, also recently, we've noticed an increase in these deer hunters, things in these deer stands, having heart attacks while they're up in the tree. Come up with a plan to get these guys out, but have a way to get to them to get them out of the woods if you work these. One of the things that they asked for last time we talked about was just treatment of all of these farm accidents. Guys, it's pretty much like any other trauma treatment. You've always got your airway, breathing, C-spine, oxygen, BVM. You have to bag them up, intubate them, take care of your airway stuff, circulation, crystalloids, blood. These things are usually, they're pretty really high shock index patients. You want to be able to try to get blood to them, 2 large IVs, if you can get blood to them. Of course, to stop the bleeding with your tourniquets. combat gauze pressure to get your bleeding stopped. Guys got to get the clothes cut off of them. If you can't see it, you can't fix it. And keep them warm. Keep these patients warm. These trauma patients don't do well cold. Causes all kind of issues if they get cold. So keep them warm. Full spinal immobilization. One of the things you want to think about is air medical transport to get them to a trauma center pretty fast. Again, think of your air medical transports. Maybe they can bring you iStats if you got to do labs if you need it, to carry blood. Most of your air medical programs carry blood. Think of getting your patients to a trauma center. And guys, one of the things I really talk about a lot in this farm accident lecture is just debriefing with your staff. Because, these patients that I said last time, these are not your normal patients that this is the third time you transport them from a car wreck or hitting a tree drunk in the last month. These are good, outstanding people in your community, in your rural communities, guys. You know all of these people. These are they're very horrific injuries, trauma. So debrief your staff, make sure everybody's okay, take care of each other, watch each other. I told you earlier about the 4-year-old that was wrapped up in the auger in the grain bin. And guys, that was ongoing care for the crews for a long time. That was pretty gnarly. Guys, one of our crews bringing in a farm accident, chest tubes, blood, these intubated. These accidents are pretty bad, guys. So take care of each other, take care of yourself, build everybody up, and get all the education and training you can, guys. And again, go into these farm accidents with an open mind. Don't get tunnel vision. Look around. Talk about these things before they happen. Have a plan before you get there. There's no book to black and white to do every one of these accidents, guys. You have to critical think. And with your experience, guys, that's how that works. You guys can do that. So guys, there's my contact information as far as my email, things like that. If you guys have any questions, ever need to reach out, thoughts, comments, please reach out. I'm always glad to help. I'm very passionate about the farm accidents. So I'm not supposed to have any kind of affiliation with any kind of brand, guys. That is a green tractor, but I'm pretty sure had that been a blue tractor, they would have made that jump.
A red tractor would.
Yeah, a red tractor would have probably got into that, got over that. But guys, I don't know how to thank you guys enough for coming back with me for a part 2 of this lecture. I'm sorry we couldn't get it all in the first time, and very flattered, very humbled for you guys to have me back. So thank you so much.
Yeah. Tim, before you get you, just stop your sharing at the moment, everything. Good. So let me, I just want to make a couple comments, especially back to grain bins that you were talking about. A couple things in here in the Midwest, we do see quite a few grain bin issues in there. But number one is if you have somebody that's trapped inside the grain bin and you're going to try to attempt to rescue with them, make sure before you empty the grain bin that they're anchored. Because if not, if you start to empty a grain bin for somebody to get somebody out that may be partially trapped in there, the vacuum that's created when that grain starts flowing out of the grain bin will actually suck the victim back down into the grain, and you'll have a worse issue than what you had. And that's the generation, the grain tube sleeves that you're talking about, the grain rescue sleeves and everything. They're a great thing. And if you're in an area where you're subject to a lot of grain bins and everything, you need to have one on your rescue truck and everything. And as you talked about, when you start, especially if you start getting these large grain bins, that are, these 2-story grain bins and stuff like that, don't make the mistake of trying to open up the grain bin at the bottom to begin with, because then you have no place for the grain to go. That's where they talk about doing it from stacked from the top down in there, because once you start flowing that grain, it's got some place to go. And if you just start at the bottom, once it fills up that area, it's not going to come out any further in there. So again, I just think that's you made some very, very good comments out here. Let me see. I think could we see somebody wants to see a slide again about signs and symptoms before you sign off.
Signs and symptoms of the organophosphate poisoning?
I believe so. I think that's the one. Let's see if you could just make sure that was, yes, that's exactly the one that she'd like to see.
Okay, let me share the screen again.
Yep. Yeah, go ahead and go back to the screen. Okay, just a second. All right. Okay, there we are. Another thing while that's going up there too, a lot of times people are under the impression that the treatment of individuals from a farm accidents is different than somebody else. The treatment is basically the same. Trauma care is trauma care in there, especially when you talk about that. What becomes an issue is trying to extricate those individuals from machinery and things like that. That becomes the major challenge in between there. Once you find the injury, same type of injuries, and they're other than the idea that most all of them are going to be dirty, filthy injuries.
Yes.
Tim, this is probably more of a fire question than a rescue question or an EMS question. But in talking about the grain elevators and the silos, particularly certain times of the year, explosions are a big problem too, aren't they?
Yeah, we discussed that earlier in the thing. The problem is what makes those things dangerous. It's all the amount of dust, all of the dust that gets in the air. It's just like there gets to be so much oxygen stuff around the particles in the air that once that ignites, I mean, it explodes. It's like dynamite. It's very dangerous.
So you can spark it with a tool if you're trying
Yes,
to.
yeah, tool, any kind of tool like that. That's what we talk about when we're actually making the cuts on these grain bins using the K12. Used to, they recommended you didn't do that, but recently the more up-to-date stuff is, use the K12 because it's so much faster, but you got to put a charge line on it with water to keep the rest of the sparks, to keep the sparks down. So that's what they're recommending now. And there's a lot of education training now out there that you can get on these grain bin rescues. I know the Tennessee Association of Rescue Squads here in Tennessee have started doing one. So any kind of that thing you can get. And I wrote this lecture. It's just a little over an hour long. I mean, it's just the tip of the iceberg. Because I mean, even Farm Medic is like 3 full days of actually doing extrication around tractors. So
that's good. The other thing is, I think your comments about debriefing is so important and everything. Again, most of these people, this is farmers taking care of farmers for the most part, and there are a lot of our EMS organizations are volunteer organizations, volunteer fire departments, and everything. And when you go out on a call, the chances of that individual are fairly significant in there. So debriefing I think, is an important issue that we sometimes overlook in between there. But again, we see a lot of times that it's neighbors taking care of neighbors in there.
yeah, no, absolutely. Especially in the rural communities. I mean, you either know those guys or you know their families in rural communities.
Right.
And again, I mean, it's just they're so horrific. I mean, you got to take care of each other because it's so horrific. It's a hard thing to see a lot of times.
And reiterate the fact again, for those of you that work in an area where you are subject to this and everything, make sure that you, if you don't know farming equipment and things like that, get to know somebody that does, that you can have at your beck and call in between there. Trying to guess on how a piece of equipment comes apart or how it works and everything. A lot of this equipment is designed not to be taken apart in there. So you've really got to have the knowledge in there. So
Yeah, Tim,
having that stuff ahead of time is great.
Tim, last time you talked about having the dealers' phone numbers on your short list or their home.
Oh yeah, no, absolutely. Part one of Down on the Farm, that one of the things we talked a lot about was having a relationship and actually going down and talking to the farm implement dealerships about a number that you can call even after hours if you need a mechanic to come out and help with this. And they're very willing to help because these patients out there that you're dealing with are their customers. They're very willing to help. In rural communities, or you've got a lot of other resources like the neighbors. They're usually very familiar with equipment to help take this stuff apart. A lot of your volunteer fire department guys, a lot of those volunteers, they're farmers. They're farmers for their real job, and they're very versed in doing all that. So there are resources out there that you can reach out to. But the big thing is having a relationship with the farm implement dealerships.
And Tim, isn't that kind of the case with anybody who has machines? Like when people in the community that have specialized machinery, that if you ever call upon them to give you a hand with an isolated situation, they're only too happy to help out. Yes,
very much so. And usually if they have the same kind of equipment, those folks know each other. And it's the same with the implement dealerships. Like I said, these people out there are their customers. They're more than willing to help.
A question about PPE not always
Yeah,
being adequate.
Yep, that's just where I was going to go. With PPE not always adequate, what are some exposure limits for organophosphates, or how quickly would you notice that you're affected by it? Boy, I'm not sure that there's a standard question. A standard answer in there. Number one, it's going to depend on the concentration of the
Yeah, the amount of
organophosphates.
exposure. Yeah.
The amount of exposure in there. Again, it's time and distance, the same as everything else. But what you want to make sure is that you've got you got your partners looking out for one another. That's one of the things that, never go into something like that by yourself. You need a buddy system in between there, and you need to be looking and taking care of your partner in there. You see signs and symptoms. Again, you start looking at, somebody's sludge, salivation, lacrimation, defecation, weakness, urination, all of that are classic signs of it. Now, again, once you start having those, you've had a fairly significant exposure. So you got to get out of there and you've got to get the treatment. And back to what Tim was talking about, a lot of the antidote kits are carried not for the patient, but for the rescuers in there. And you should always make sure that you have an adequate supply for what you're being within your operational area. If you like this, tell your friends. This stuff is free. Okay. And I think that the topics are actually very, very, I may be biased. I think that a lot of them are very, very good, in there. So again, if you find these beneficial and everything, tell your friends, sign them up. We would love to see, as many people as possible coming in here. And as Will indicated earlier and everything, if you have a topic or something that you would like to see us look at or something like that, or a topic that you'd like to see a presentation on, please send us an email, and we'll see what we can gather up and hustle up for you. Or if you have someone in mind that has a good that presents a good topic and everything, let us know. Again, I want to thank Tim as usual. You're fantastic. I'm blessed to having met you earlier this year in Tennessee, and you've done a wonderful, wonderful job for EMS. And I thank you for helping to continue Dr. McSwain's legacy of providing education to trauma providers. I think it's been wonderful.